Thanks for coming to the talk. I'm Dr. Thurman. I know a lot of you, and I feel like I need to thank my patients. It's like you haven't heard enough in the office already that you're like, oh, come back for more after hours. It's like going back to school, after the teachers have let you out. Anyway, so I'm one of the family doctors here at KCH. Been here since 2021, originally from Shelby, just right up the road. I live with my wife and our 4 sons, and we have a busy house. So it's like, this is almost like a break, right? So anyway, the name of the talk, I said, Family Medicine to the Rescue. That's kind of a lie. I'm not a superhero, Really, it's more of a cheerleader, but that didn't have the same ring to it, so I thought this is probably a little better. And then, our goal is going to be to find our way to wellness. It's not like this is a destination. You're going to leave here and you're just going to be well. Spoiler alert, right? Sorry about that. We're going to answer the question of, what is family medicine? That's my specialty. We're going to look at what are some components to wellness, like what does it mean to be well, but I think just as importantly, we need to think about what are some barriers to being well. And then lastly, we're going to talk about what does wellness in action look like? What are some takeaways? And my challenge before you leave tonight is that there's one something to take away, one piece of wellness to go home with, and I'll feel like I've done my job. You might not remember much, but if it's one thing, that's a win. So let's go to the first section here. So what is family medicine? It's a whole lot of people, right? So family medicine, no offense to other primary care specialties, but I think this one's the best. Don't tell the pediatricians, the internists, the OBGYN, the geriatricians. They do a great job, don't get me wrong. But I think family medicine, we're like the Swiss Army knife of the medical community, right? So it's like whatever problem, it usually starts at your family doctor. Can we answer all the questions? Probably not. My patients here know that sometimes you get a referral to a specialist. Sorry for that. Sorry, I don't know everything, but I said I'm not a superhero, right? So in family medicine, we take care of people from birth all the way to death and everything in between. There's never a dull moment, and I think that there's a great chance for impact, and that's why I've put all my eggs in this basket. It's 4 years of undergrad, 4 years of medical school, residency, and lots of hours honing this craft, working with all of you. And another kind of secret to this talk is a lot of the content is from you guys. It's from my experience working with patients, like what works, what is a way to be well. Yes, there's lots of book knowledge that I've learned along the way, but the truth is, it's like in practice is really where the learning happens. So let's go on to the next and just talk a little bit about some of these components to wellness. If you can kind of make sense of that picture, I'm kind of creative, but when it comes to tech, sometimes it's not. So I really like fruit, so I chose the watermelon, right, to be timely. And then cut it into slices, but then you'll see there's a fence in front because it's like, sure, this is a healthy thing, but man, sometimes you can't just reach into the watermelon patch and get that piece of watermelon. There's something in the way between us. Hang on, I've got to change my sheet here. Throughout this, we're going to talk through a couple different areas of wellness and some of the barriers there. But the question is wellness still possible, even if it's not easy to get to, even if there's a challenge, even if there's a problem? And I think the answer is yes. And I think it's important to say that, yeah, there's different sections of that, and that's like nice and neat and tidy. But the truth is, it's like a problem in one of those areas leads to a problem in another one. It's all interconnected, so it should have just been like the whole watermelon, maybe mashed together or something. The other reason I think it's important to talk about these barriers, I'm biased that I think that building compassion is an important thing. And it's easy to say, well, why doesn't this person just do that? And it's like, well, you've never walked a mile in their shoes, so maybe after this talk, there's a little bit of compassion that you walk out of here with too. So anyway, we'll take each of these in turn. So let's start with the first. So relationships. So relationships are important. That's no surprise. So this idea of, being able to heal, to fight off illness, to carry on, it's really tied to who's around us and where we get that sense of belonging. So that's like a family or a club or a school, a spiritual community, a workplace. Those are all kind of ideal scenarios where relationships really give us that sense of belonging. But that's not always the case, right? Life is hard. And there's times when that's not working well. A specific one that I see a lot is loneliness, right? There are people in this room that are experiencing loneliness, have experienced loneliness, maybe right now are, from the death of a spouse or end of a relationship. And studies have actually shown that poor social connection or social disconnection has been associated with increased risk of heart disease, of stroke, of dementia, of depression, anxiety, suicide, hospitalization, emergency department visits, and probably on and on and on, right? And that's not surprising. It's like, yeah, we were made for a relationship, and when that's not there, this is what happens. One of the things that I thought was interesting, a few of my patients who were both experiencing loneliness got with some of their friends, and they said, let's just choose to not be lonely. And let's make dinners for each other. And let's alternate back and forth and back and forth. And it was like, that was kind of a neat way of working through that. Another way that, I see relationships being important is, in the workplace. That's a place where we can belong. If for some of us, it's like our work really gives us a sense of meaning or purpose. And, those are people that we like to be around. But at the same time, work can be hard too. And that can be a barrier to health. We think about how work has changed in the last couple of years with the pandemic, with, being short-staffed, with, people not having a sense of autonomy. So I think that's those are a couple barriers to think about for this idea of relationship being a part of wellness. So we've seen about relationships and how those play a part. How about the medical or genetic part of our life? It's fun to imagine that we're like just going to be 29 again. I am not 29 either. 39, if you were wondering. And you could eat anything you wanted. You could stay up late. You could kind of like do all these different physical activities and feel fine the next day. But maybe that's not reality anymore, right? So I want to talk first about the medical side of things. These are the health problems, the things you come to see me for, the list that you bring out that has the things that are on. You guys are laughing, but it's true, right? You've all done it. So those are numerous. It's like when health is great, that's wonderful. We don't think about it. My 20-something patients, I saw a guy today that's about to go to college. Is he thinking about his medical problems? No. He's thinking about, like, I get to go to the university. I get to, you fill in the blanks of what he's thinking about. But let's say there are some problems that make a barrier. So any chronic illness, even if it's, low thyroid, you have to take one pill a day. Something to think about. One more thing to keep track of. Then those problems start to grow and you develop a few of them, high blood pressure, diabetes, high cholesterol, maybe you had a heart attack. All of that is kind of shifting the focus from just, well, I want to be well to, I just want to survive. I just need to get through this problem, or I want to not have this problem again. So yeah, this idea of taking focus away because of the time required, the thought required to deal with that illness. And then what about injuries? I think everybody's been injured in some way, but sometimes it's terrible. I have patients that they're injured at work or at play, and they can't work anymore, or they deal with pain every day. So I think that relationship between injury and pain and how that can be such a barrier to health. If it's every minute, every hour, every day that you're thinking, man, if I can just not have pain, then I'd really be there. then how about a barrier to health of other forms of disability? Let's say from a stroke or from a childhood illness, or you've ended up wheelchair bound for some reason. So the question I have is, like, for all these, is there a magic pill? No. For some of these things, medicines can help, right? So I'm not anti-medicines, but I think that we have to resist the urge to think if I just had the right medicine, if I just went to the right doctor to solve the problem, then I would feel better. Sometimes that happens, and there are these breakthrough moments, and we love those as doctors. Oh my gosh, and it gives us this probably inflated self-esteem for a minute, but then we're humbled the next patient. But I think that there's a tension there of, we treat the medical problem, but we also have to admit that there's probably some hard work to get to the other side of that barrier. To treat that problem is going to take more than just a medicine. So that's just a plug there, something to think about here in the future. Because really, each of these problems that we're talking through are just one component of health. So we can't just focus our attentions there, right? So now let's talk about genetics. So that's kind of like the cards we're dealt. On one hand, I think about people who have hit the genetic lottery. At our house, I said we've got 4 boys. We talk about athletes a lot. Has anybody heard of LeBron James? Or Aaron Judge? Sorry, he's a Yankee, but he's really good. Those guys have hit the genetic lottery. They they are made for that sport, and they're really healthy. But what about the rest of us? It's kind of a mixed bag of what we inherit from our family, medically, emotionally, socially. On one hand, you have patients who are living into their 90s, and they come with their younger or their kids, and their kids are like, man, my mom is healthier than me. It's a great situation. But what about people that have a history of heart disease or of strokes or of dementia in their family? Lots of times folks come in and say, hey, I'm concerned about this, doc, because I look at my family tree and it's not pretty. And so what can we do about that? So, there's this kind of, by default, there's this barrier to health, right, that you were born with. You didn't do anything to deserve it, but be born to that family. So can we prevent those things? Sure, to a degree, but some of it is these are the cards we're dealt. So then, another thing just to kind of talk about the scope here of genetics is we see patients that congenitally, have developmental disabilities. You think about cerebral palsy, you think about Down syndrome, and it's there's a difference in terms of what health is possible when you start with a disability in the beginning. Is health possible? Absolutely, but it's going to look different, right? So we've talked about relationships, we've talked about the medical and genetic sides of things that are parts of health, but the barriers that they have. Now let's talk about mental and behavioral health. This isn't an important topic or anything, is it? Yes, it is the answer. And hopefully, some of us, or I think we've all had days where it's a really good day. You feel motivated. You feel you get all of your tasks done. Maybe you had a healthy breakfast. Maybe you exercise and you feel like, I am on top of the world. I can do anything. There's a confidence or a swagger or just you feel good. But is that every day? No, absolutely not. So it's we would be foolish to say that the mental doesn't lead to the physical in terms of our health or well-being. So we treat conditions like depression or anxiety or bipolar or PTSD or other effects of trauma and talk about working from a deficit sometimes, if that's your story. And the trouble with a lot of those is nobody can see them, right? You can't see that somebody is struggling with that. And it's not until we kind of go through the work of having a conversation and talking through what's really going on that we get to that. So one of those specifically is grief. Is often I'm seeing patients who are struggling with grief. And that is so debilitating. And it looks a lot of different ways to a lot of different people. I think of one example of a patient that, we were trying to treat his blood pressure, and it was we added a medicine. The next time he came in, we added another medicine. And then it's what's going on? This is not working. Why is this not working? And he said, I haven't been honest. I've been drinking a 12-pack every night for the last 2 years. It's like, okay, but why? His dad had died, and he hadn't dealt with the grief. And so it's like, we were trying to treat a problem medically that it was a medical problem, sure, but it's like, we weren't getting at the heart of the issue. And then I think about like, how is anxiety related or worry? You know, I have a mom of 2 young kids who finds it hard to like leave the house. Just a problem, you know, and like, she's just so worried, so anxious. And so we're trying to have this conversation about, you know, exercise. We're trying to talk about, you know, making healthy choices. But she says, Doc, it's like hard for me to even go to the grocery store. So the first thing we have to deal with is the anxiety before we can say, okay, here are some, you know, ways that you can be healthy. And then, you know, I think the same thing is true with depression. You know, it's like, to say, I'm gonna make some really good health choices. I'm gonna be motivated to exercise. To do that when you're already depressed is like, that's not gonna fly. That's gonna be so difficult. So at this point in the talk, you're probably like, wow, this is really uplifting. I'm so glad that I came. Dr. Thurman is just really putting wind in our sails. I'm sorry, but it's like we have to talk about the hard things to get to hopefully how we can help. So we've talked through the social relational parts, the medical parts, the mental health part. Now it's like another part of health, unfortunately, is financial. It's like there's a socioeconomic part of this, partly because we live in a country where that's like this costs money. So often, you know, we take for granted the fact that we have a place to live, or we can get to the doctor, or we can pay for lab tests or any other tests, but that's not always the case. You know, I think about just transportation, that simple tool. I have 2 patients with diabetes, and I just want to like kind of contrast their stories. One has, you know, the social part where they have a spouse who's really helping them manage it, but also brings them to appointments. They're like never late. They're able to come, and we talk through a management plan, and her diabetes is under good control. Contrast that to another patient of mine who doesn't have a reliable car, actually lives in the next town over, has the same diabetes, but he can never make it into appointments. So who do you think has the better control of their diabetes? Well, it's her, but well, could he have if he could just get into appointments? Maybe, right? And then I think about, you know, how healthcare costs keep people from finding out more about their health or doing things for their health. Specifically, you know, ordering a test. Like for us, that's really easy. All I have to do is click a button and it orders a test. But for you all or for my patients, it's like, it's not that easy. It has to be scheduled. So you have to have a phone that works, that, you know, answers when it's, well, this is a 740 number. I don't know. Is this the insurance company or is this my doctor? So you order the test. You have to schedule it. Then it's a matter of paying for it. It's like, am I ready? Am I able to pay for that heart ultrasound right now? Can I do that CAT scan on my lungs? Is my insurance going to cover the colonoscopy, the mammogram? So it's like, there are so many barriers to doing these healthy things that it's like, on paper, you're like, sure, yeah, I want to prevent cancer. Sure, I want to find out but then we have to like live in that tension of cost. And man, that's frustrating for me because I'm like, I just want to help. And there's this confine of finances that makes that really hard. Going back to that picture of the watermelon. So it's like, there are all of these components, and that's not even all of them, right, that I listed, but there are these components to health, and there's barriers to them. So the question is it even possible to be well? At this point, I'm hoping that you're still like holding on with me, that maybe we can get there. So this guy thinks there is, right? It's a pretty cute picture. So I think it's important to break things down in simple ways. That's like how I try to do my job, so that there's a takeaway point. There's something tangible that we can go away with. But I've started to, over the past couple years, think about wellness as a concept that's like 3 components. it just so happens, getting ready for this talk, it's like I turned it into like this, nice acronym with all M's. But, I think wellness comes down to three simple things. And this isn't all inclusive, but I think these are three priorities to focus on. I'm just going to go to the next slide and we'll just talk about these in order. So first, meaning. I saw a shirt once that said, "What is your why?" And I think that's an important question, right? What gets us out of bed in the morning? What is it that motivates us? And again, as I was preparing, I thought, that's probably a better question for me to ask people than, I like to know where you're from. I like to know what your hobbies are. But it's like, probably a better question is like, why do you want to be healthy? Why do you want to come to the doctor? Is it just some guys and you can nod your head like you're here because your wife made you come, right? And it's even better when she comes with you because something will actually happen. No offense. But I think that answering this question or pressing into this question for each of us individually is important. What is your why? What gets you out of bed? And why are we here? If we want to get really existential with it, we won't go too far in that direction. But, I think about one patient who I thought illustrated this really well. Again, I'm going to pick on a guy. He had this new diagnosis again of diabetes. Okay. And, if anybody knows anything about that, you have to change the way that you eat. You have to change, some medicines that you take. You have to be more active, all these things that doctors are demanding. And he was just not doing it. He had the diagnosis for 10 years. But now he saw me when I think he was in his late 30s. And all of a sudden, his numbers are better. What happened? Why did this change? And I'm asking him, and he says, "Oh, yeah, we have a baby." It's like, okay, great. So his motivation changed, right? It wasn't just about him and it was annoying to treat his diabetes. He thought, I kind of need to treat this if I want to be around for this kiddo. But what are some other ways that we can pursue or connect to meaning? I think about volunteering. So it's like there's a lot of nonprofit organizations around, and there are ways that we can help in the community. I think that can connect us to meaning. I think about, spirituality or church communities. Mount Vernon's a pretty good place for that, to connect to what is my meaning, how can I help? And I think specifically, too, this question comes a lot when people retire. That there's a disconnection from what is my day-to-day, what is my meaning? Just walked out of my last patient's room earlier, and that was the question is, what is my purpose? I feel like I've kind of lost touch with my purpose. And I wish that was a prescription that I could write, here you go, but I think that wouldn't work out very well. I think about, I think about my patients that are doing well into their 70s, 80s, maybe even 90s. And one interesting thing, and I'm sure you can all identify with this or guess what I'm going to say, in this community, it happens to be a lot of farmers. And I see farmers that are like way up there in years. They haven't retired and they're still doing well. And I think that's part of where this meaning, movement, meals thing came from, is seeing them and how they live their lives. So that's meaning. The next thing is movement. So notice what word that is not. It is not the E word. Exercise, right? I think that's a swear word in some ways, so I try to avoid it at my house. If I say it, my wife pinches me. But I think movement is an important one because it's like literally just getting up and doing something. And I think thinking of it this way rather than exercise, that means everybody's invited. Right? If you're in a wheelchair, you can still do some movement, some upper extremity activities. If you can't really walk well, you can still do things in a chair. You maybe can't do things as fast, but you can still move, and I think that's important. There's actually a couple studies that say that a sedentary lifestyle may be a bigger risk factor than things like smoking, high blood pressure, or diabetes. Does that seem possible? Yeah. But I think it's worth seeing if they're wrong, So again, that's a prescription I wish I could write, that it's like, here's a movement prescription. I think over the years, doctors have tried to do that. I don't know if it has worked, but maybe next time some of you come, I'll write a prescription for that. So then there's always the question of what type of movement, or I'm going to use the swear word, exercise, is best. And you know what I tell people? It's the one you'll do. It's the one you'll do, right? Because that's what I want you to do. I want you to move. And, the side effects of it, you might increase your joy a little bit. You might feel better. You might feel stronger, and you might keep doing it. And I think, you'll be more consistent with it. So again, the takeaway is the best exercise, the best movement is the one that you'll do, okay? So what are some examples that patients have come up with that I've liked? Lots of people talk well, I guess I can go for a walk, and again, back to we're in this rural community. Some of you guys have a lot of land. Walk on your land, explore it a little bit, go for a hike. Walk with a stroller. That guy that had the baby, maybe that's something that he'll do. Take your dogs for a walk. Again, just even thinking about today, this one patient said, well, I'm fat. I should take my fat dog for a walk. And, you just can't make this stuff up. But it's okay, sure, take care of your pets. Workout classes for some people are better. They like the social connection there. So yoga or water aerobics or pickleball. I don't know if I have any pickleball players in here, but okay, great. I think gardening. That's a great example. We have a community garden in our neighborhood now that's been really neat to see. And there's this one story that came out of that. There's this woman in her 80s who has made it a point to walk with her walker all the way to the community garden once a day. And she said to the people who were running it, "You saved my life." That's crazy, right? For a little community garden, because I think it gave her a sense of purpose, but she was also moving, which was really neat. Going for a hike. And then, I think for the lucky few, movement sometimes is part of our work. I always tell people that I'm jealous when they are using their body more, because I sit in front of a computer all day and talk to you guys, which is great, but it's not a whole lot of movement. So what's the last M? The last M is meals. So I'm not saying macros or macronutrients. We've all heard enough about protein to sink a ship probably by now. But meals, real food, actual food ingredients. I think that there's been a trend away from that because, man, it takes too much time. It's too expensive. I brought a prop with me. This is not a Frisbee, although it could be. It's this healthy plate idea. I don't know if anybody's familiar. It does not have a TikTok following, or it's not very popular on Instagram. It's not going to make you famous. But I think it's a good concept to work through. The idea of a meal that is well-balanced and healthy is going to be half of the plate is what? Vegetables, thank you. This is great. This is a wonderful class. A quarter of the plate can be a protein source. Now, I did say protein there because it doesn't have to be meat, which I've learned is a little bit of heresy here in Knox County to not talk about beef or something. But a protein source, so that's, eggs, can be nuts, can be beans, can be meat. And then a quarter of the plate, like a whole grain, or you could throw some fruit on that spot. But I think that's a really a good framework that's pretty simple. And I always tell people probably lunch and dinner. Here in the U.S., we don't really eat vegetables for breakfast, but we could, I guess. So if anybody starts to do that, let me know. So a couple just takeaways with meals of ways that we can be healthy here. One is, I think it's going to take a plan, right? It's like when you show up at the grocery and you don't have a plan, it's like, what are you going to buy? Probably the ho-hos. Or whatever looks good and whatever's on sale. So making a plan. I think that, I'm kind of a simpleton when it comes to food, so I always advocate for, can you eat consistent things? I have the same lunch most days. And I'm okay with that. Some people are like, I can't do it. I have to change it up. So, but if you can, I think that's an easy way to stay within the confines of a healthy diet. Shopping around the outside of the store, you guys have heard this before. It's like in the inside, it's the processed food, it's the simple stuff, but the fruits and the vegetables and the meat and the dairy, and then gotta have the ice cream, right? Cooking foods in a batch at the beginning of the week. Cooking for one is difficult, but if you can make a batch and eat on that throughout the week, that's, I think, kind of a win. Family dinners, if that is a place where you are, that's possible. That's something to prioritize. Again, studies have shown kids who grow up in a family where they're eating together, there's, I have to read this, healthier views of food, which is a win for the rest of their life. Family ties are strengthened, and I think it's going to be cheaper for a family to eat at home together than eat out. Then fast food, just to plug, like trying to eat less of the fast food because of the last thing, which is trying to avoid the processed kind of everything. More real ingredients. It's going to take time, but I would argue it's like, man, health doesn't just come easily, right? It's like you got to pay something. And I think time is pretty precious, but I think this is worth it. So last slide here. Yeah, so back to the watermelons. So wellness, it's a direction, not a destination. So we want to be moving that direction, or I hope you want to move that direction. I think it's important to look for barriers. What are the barriers that you have? Hopefully your doctor is helping you think through that, or nurse practitioner or PA. But what are the barriers to me being healthy or really going after this health thing, and try to get around them and be creative. And then think about the 3 M's, so meaning, movement, and meals. And then I think you're going to be okay. You're not going to be perfect. None of us are, but I think that's a good start. So that's all I have prepared, but I'd love to talk through questions that you guys have, comments, suggestions, or if you just want to play Frisbee, we can do that too.